On the last episode, we specifically talked about two things. One was facet joint arthritis and disc issues. Now in this episode, we're going to specifically talk about muscle pain and how to tell the difference between, is it a muscle pain, is it arthritis pain, or am I dealing with a herniated disc? So let's go ahead and get started. So specifically when you're just having muscle pain, it really is coming from probably when you bent over forwards and then you went to pick something up. And in that instance, the issue is you have specific joints in your spine, and these joints are going to pivot at certain points. And typically what happens is the weak point, where there's a weakness in your part of your body, in this lower part of your back, that's what's going to give. Now specifically the quadratus lumborum muscle, or QL muscle, is the muscle that tends to really stabilize the lower back, as well as the multifidus muscle. Now I have a whole catalog up there, I'm just going to link it right there, that specifically talks about treatments just for those types of muscles and why it's important to strengthen those after you injure yourself. Now in this episode, specifically that pivot point, that's where the weakness is going to come from, those two muscle groups, as well as this long muscle that runs all the way up down your lower spine. And that muscle group has three layers to it that connect on the inside and also on the outside lower part of your back. And they really help with the rotation motion of the lower back. So when you're rotating your back, or when you're bending forwards and you lift something up, there is going to be, unfortunately, a little bit of rotation even with the best mechanics on the planet. Now, three treatments you want to do when you specifically just have a muscle pull is, one, you want to ice it for a good 72 hours to get that inflammatory process to calm down with some anti-inflammatories, which usually will include, like I always say, either Aleve, ibuprofen, maybe naproxen. So those are nice 3 over-the-counter drugs that you can take for a few days as long as you don't have stomach problems. Like I said, you want to ice it, and you want to try a TENS unit. Now, I'm going to go ahead and leave another link up there that talks specifically about a TENS unit, TENS, that you can literally get on Amazon over the counter nowadays for probably $5 or $10. Slap that on your lower back, or where you're having that muscle pain at. Surround the area. Wear it for 15-20 minutes. Try that for 3 or 4 times and give it about 2 or 3 days of doing that. More times than not, that will also really help recover, because with that electrical stim, you kind of stop that spasm, muscle spasm, from that occurring, and that also helps relax those muscles, and when they're relaxed, they tend to heal much faster. So another treatment idea is make sure you're increasing your protein intake, because as muscles get damaged, the way to recover from them is to add more protein, whether you're weightlifting and breaking down the muscle fibers, or whether you've injured something. The process is still going to need protein to help recover, and that's a good point. 60 to 80 milligrams, not milligrams, grams of, milligrams, right? No, 60 to 80 milligrams, I keep saying that, 60 to 80 grams per day when it comes to the type, how much protein you need to take. So when we're looking at that particular issue, just a muscle pull, why did it occur in the first place? More times than not, it's the weekend warrior. You went to lift and unfortunately maybe turned with something just a tad bit too heavy. And it wasn't felt heavy initially. That's because your muscles were warmed up. The joint was warmed up. But you get warmed up, and then all of a sudden you get that energy and you lift something too heavy, and then it gives. So I do have a catalog. You definitely want to strengthen in front as well as behind the back. And depending on what you're lifting, making sure if you're lifting overhead that you have a wide base of support when you go to pick something up, to lift it up over your head. And of course, more times than not, it's always smart to have 2 people lift something versus 1 person. But in reality, it doesn't really happen, does it? So we talked about icing, anti-inflammatories, resting the body, TENS unit. Those are all the acute phase. Those are the first 72 hours of an injury. And then with any muscle pull, you're definitely going to want to strengthen that part of your body afterwards, because it's gotten weak. It might have no more pain, but it's definitely weaker than it was before you hurt yourself, and you don't want to go ahead and hurt yourself again or have a fear of hurting yourself again. So if you have any further questions about that, go ahead. You can leave comments down below. I go ahead and look at them at least 2 or 3 times in a week, or once a day, depending on how busy my schedule is. Now, the last thing we want to talk about is what's the difference between the three, right? So you have the muscle pain, you have the arthritis, and you have the referral or radicular pain coming from nerve pain. Now the least of them is what I'm talking about today, which is just muscle pain. You get a pull, you strain that muscle group, goes into spasm, and then it needs a few days to recover from that type of injury. Because what happened is you overloaded that muscle group and took it beyond its point, and then it caused a little bit of what we call micro tears. So, but that's not going to give you any referral pain, or if it does, it should be very just localized. It shouldn't be going way away like I talked about in the last video, going from the back and going into the groin, or it's not coming from some sort of inflamed nerve, which is shooting way past the segment where it's coming from up here and it's shooting way down your leg. So best bet, likelihood of the three, hopefully you just have the muscle pull. So if you have any further questions, go ahead and leave them down below. But until next time, Scully and I always like to say look up and keep smiling. See you next time, folks.